Okay, so again, Josh, thank you so much for taking the time and chatting with us and telling us your story. Just tell us how it all started. How did you find out about having COVID-19?
It's funny. I was surprised. I was surprised when I learned that I had it because it had been a couple weeks and I had been going on the same runs that I always go. I run 3 or 4 times a week and I was noticing shortness of breath. That was a couple weeks and I was chalking it up to allergies, and we were having some Kona winds at the time as well. So didn't really think much of it. And then I had like a test done for a safety protocol at work and found out that I was positive, and all of a sudden those things made a little bit more sense to me.
How were you feeling at the time? Did you have these symptoms that everyone always talks about?
No, I didn't have it. When I found out that I was positive, it felt kind of just like your typical allergies type of thing. I was having a little bit of congestion, tightness in my chest, difficulty breathing. I had some sore throats and swollen glands, which were a little out of the ordinary. But it wasn't until maybe a week or two after I got diagnosed that I actually started having serious problems, or at least more serious problems. I don't want to make it sound like I had a really terrible case. It was mild in that I survived, but I had about 7 to 10 days where I was really struggling to breathe. It's kind of, to put it I would explain it like sort of an asthma attack feeling. I'm very aware of my breathing, and that's very uncomfortable and kind of scary.
So what did you end up doing? What did your doctor advise you to do?
When it got bad to the point where I was worried if I was getting enough air in my lungs, it didn't feel like I could catch up on my breath. I went into the ER, and they checked me out. They did tests on me. I was still positive. They gave me some drugs to help me breathe better, and it helped a little bit, but it was still scary. My wife was a little bit. Uh, she wasn't. She didn't want to leave me alone. She wanted to make sure she had eyes on me. It was that kind of thing. So that was uncomfortable. I got one of those little oximeters that you put on your fingers to check your blood ox level, and everything looked normal. It just felt so weird and scary. And then, of course, the news and podcasts everywhere around you are all these discussions about how people are experiencing this thing differently, how people in my age group and in my 40s, how people in my age group are having blood clots, embolisms, and strokes. There was a psychological component to it as well. It was frightening just because you didn't know what to expect. When you get the flu, it's like, yeah, I know what the flu is, but here everybody was experiencing it differently. My wife was also sick, and her experience was very different than mine. It was much more mild. She might not have even known she had it if she hadn't tested positive.
I guess what was the feeling when you felt like you had done all you could to prevent it, right? Because what was the timeline here? When was this? Was this back in March,
It was back at
April?
April timeframe
So it was
when I
early
started.
on.
Right. Well, it was scary because they were talking, the news and everybody was talking about all these CDC guidelines. And so I was trying really hard because I was still working. And I have my wife and my stepson at home. I wanted to not bring it back. So, a lot of singing happy birthday and washing my hands. I wasn't wearing a face mask because back in those days, the guidance on that wasn't consistent. I thought I was being careful, a lot of using, hand sanitizer and stuff like that. I would even change my clothes when I got home from work just to make sure it wasn't on that. Have no idea how I could have gotten it. And even being careful and staying within my bubble. So that was confusing. I remember being on the phone with my parents and being like, hey, don't take any chances. I can't lose you.
Luckily you don't live with them, or they're not near you, right? I think a lot of
No,
the
they live in
concern is
Florida.
spreading. Okay, well, that's good. But yeah, like what we're seeing here in Hawaii is so many people are worried about, like what you said, bringing it home.
Yes.
And while it might not have been so big of a deal for you, but others may have had a different reaction, right? So as you see what's happening with others here now, that it's gotten to a level where it's so high, what's your thoughts? What are your thoughts as someone who's lived through this?
Well, I would say that it always kind of frustrates me when I walk into a building and someone says, "Do you have any flu-like symptoms?" I never had any flu-like symptoms. I never had a fever the entire time. And they place a lot of emphasis on, "Hey, do you have a fever? Do you have chills?" No, I didn't have those things. So that kind of makes me worried that people are thinking, well, if I don't feel like I have the flu, I don't have COVID. I didn't know I had COVID when I got diagnosed with COVID. I might not have known until I started having problems breathing, and by that time it would have been too late. I think it's human nature that people think, hey, I don't know anybody personally who's had it, so I'm safe. And I guess what I'm worried about is people leaving their bubbles and going out and doing things, because it's been a tough few months for our country, and people psychologically need to feel close to each other. That's a big part of our culture here in Oahu and Hawaii. Um, so I worry about people getting complacent or getting tired of the restrictions. And so I'm just hoping and praying that people keep taking care of themselves so that they can take care of others.
Yeah, luckily you were the ones that didn't have to be in the hospital, right? You did go to the ER, but you weren't hospitalized.
Correct.
So I guess how do you explain to people? Because again, even if they think, well, I'm going to get it and I won't, I'm young, like your age or even younger, they have this kind of sense that it's not going to hit me hard. I won't need to be hospitalized. I can live through it. What would be your advice to them?
Um, I would say that it's not about us. It's not about us. Well, let me put it this way. There are two things that I want to say about that. First, mild cases aren't mild. Mild cases are scary, and even if you get through it, it can be tough. It can be scary. It can scare your families. You could bring it home to your families, and those are risks that nobody should take. And then the other thing is, it's not about us. It's about the aunties and uncles and grandmothers and grandpas and people who have immune deficiencies or other high risk factors. We should be careful for them. And if we can take care of each other and be careful and just, gut this out, we can get to a point where, uh, the healthcare system can catch up, and we can take care of this COVID thing once and for all, hopefully, and
Yeah,
get
and
back to going to movies and partying on the beach and stuff.
yeah, that probably will happen for a while, I think, at this point, right? With triple digit numbers every day.
Yeah.
But we are seeing, for example, you mentioned you didn't know where you contracted it, right? You just didn't know whether it was in a grocery run or at work. But right now we are seeing the workplace being a hotbed, right? Tell us about how your workplace supported you, what it was like, um, you know, people around you have the stigma about talking to you about it.
Hmm.
Give us kind of a picture of that.
Well, so in the beginning, they were really concerned about me. Immediately, I was teleworking, even though I didn't feel symptomatic. I was allowed to go home and telework and stay away from the workplace. Somebody from my unit would call me twice a day to check on my symptoms and make sure there wasn't anything I needed. People that Colleagues that I don't even talk to on a daily basis were contacting me and asking me if they could go do grocery runs and things like that, because the entire family had it, so we weren't able to leave the house. So it was really heartwarming to feel that connection to the community and my office mates and them reaching out to take care of me. I hope everybody does that for anybody they know who has COVID as well. And then after I got back to work, everybody knew, uh, you know, what had happened, because I conspicuously disappeared. Um, and they could put two plus two together, right? Some people would take a step away from me when they saw me. And I understand that. And I think I probably would have done the same thing. Even though, I feel like having tested negative multiple times before I went back to work, I was probably the safest person in the room. But I understand there's a bit of a stigma about COVID, and a lot of people don't, again, sort of like the mask thing. There's inconsistent messaging about whether or not you can get it again, and so people were a little bit more cautious around me.
Yeah, I wanted to ask you about that stigma. We were talking before about how difficult it is for me as a reporter to find people to share their personal stories because there seems to be this kind of silence that around this virus that,
Right.
like you said kind of briefly, people don't understand it yet, right? So tell us about the stigma. Like, did you feel a lot of that kind of, um, I don't know, just people treating you a different way and how we can get over that, perhaps?
It was subtle, I don't, and I'm sure people didn't even realize they were doing it, but it was mostly like people taking a step back from me when I came into the room, or people putting a mask on real quick when they saw you. And I get it. I think it's just going to be the way it's going to be, and I don't necessarily think it's a bad thing. I think people should treat everybody like that. I think that the safest thing would be for everybody to kind of keep their distance, and it goes against human nature and the way that we want to be warm with people. But I think it's probably a good thing that people keep their distance from anybody who's not inside their bubble, at least for now, and then we can go back to normal and however long it takes for us to figure this thing out.
Yeah, I wanted to get your take. There is this debate. I did a story recently about this debate about whether you should identify the location of people, right? Like we always advertise. Well, there was a case at Costco. There was a case at this particular school, this particular business. And as someone, I know you work at the base, so that doesn't really affect you, but what do you think about people getting more information about where a positive case was? Do you think the public has a right to know?
Um, yeah, well, I mean, I will tell you this. The contact tracers from the military were all over me. I also spoke to the Hawaii Department of Health as well. They knew where my whereabouts were. Um, to the extent that people are doing what they're supposed to do when they are diagnosed with COVID and they're staying home, I don't think people need to worry too much about what the contract tracers are doing or not doing. I can tell you from personal experience, they love to bother you and they call you all the time. We had public nurses calling us multiple times a day. Jesse would get calls, I would get calls. They knew where we were. Folks need to understand that when people test positive, there are multiple people who are watching them and making sure they're doing the right thing.
Yeah, that's a good point. I think there's just seems to be a lot of distrust of the system, I think, right? They feel like, is it really working? Are people keeping tabs on people who are taking positive? And actually, they had to ask about your contacts too, right? That was part of the
Yeah, yeah,
whole.
absolutely.
Yeah. So, and they have to be quarantined as well. Do you trust that system now that you've been in that system?
Yes, absolutely. Because we were on lockdown, and if we weren't there to take one of those phone calls, people would start asking questions immediately. And I could tell you that in the military, they're really concerned with that. I mean, not just people who have it, people who are around people who have it. It's really important that we are ensured that the people who are symptomatic or even asymptomatic that have been exposed are doing the safe thing and staying home. And I know that we have had very liberal policies about teleworking to keep people safe. And I think that every employer all across Hawaii and the nation should be doing stuff like that.
And how are you doing now? How are you feeling? Is there any kind of lasting, health side effects from what you went through?
Well, I feel pretty good. I'm definitely blessed and fortunate to have gotten through it. Um, I will say that again, it's not like the flu for me. And again, to those people who maybe think I'm young and healthy, well, yeah, but it's not like the flu where you have it for a week and then you're back to regular business. This thing it lingers. I've been having those same things. There's the same difficulty breathing on runs that are routine for me. I've had to struggle to get through that. I went to see a doc, and he told me it could be 3 to 6 months before my lungs feel normal again. I still have a little bit of that lingering lack of smell and taste. Things smell a little bit differently now, and that's really weird. And that affects how you perceive taste as well. So that it's a minor thing, but it is something that reminds you every day of what's going on in the world.
Wow, that is kind of strange to hear. So has it
Yeah.
affected your daily life now? I mean, do you do things a little bit differently? I know you said you were already careful to begin with, so I don't know if having it changed your kind of lifestyle in any way.
No, I mean, it was hard for me to understand at the beginning how I even contracted it as much as I was trying to be careful. Um, I can say that I've been a lot more careful about being in tight quarters with recirculated air with people. I try to stay, I think it's a good practice to follow the governor's guidance on no more than 10 people in a room. That's something I'm really strict about. Anytime I leave my home, I'm wearing my mask if I'm not exercising and keeping my social distancing. So yeah, I mean, I'm just trying to do the same thing I was doing before, and hopefully I have antibodies and I'm not going to get this thing again. But if I do, I know I'm going to get good care. I know that I'm going to do the right thing and stay home. And I just hope I don't get my family sick again. That was really one of the worst parts of it all.
Yeah, and that continues to be a lot worry for a lot of people. So did you give your plasma? Just curious.
Oh,
Because
no, I haven't done it yet. I am doing a study where I'm donating blood and samples and stuff like that to a COVID study, but I am not a big fan of needles. So
because I know the blood bank is in desperate need of plasma. So
I know that to be true as well. I
yeah,
know that to be true as
so
well. If it could
you
help
might get
somebody, I
on it.
would do it.
For sure, for sure. Okay, so I did want to ask you. You know, I'm sure you've heard the debate about the hydroxychloroquine or that drug.
Yeah, yeah.
What do you think about it as someone who's were you given that? We always get these people writing in that it's the miracle drug, but I don't know if you had it.
Man, I hope it's a miracle drug. Nobody ever gave it to me. I think it's usually for the people who are hospitalized that have the more severe symptoms. So I don't really have any experience with it. Hey, anything that helps, I think people should be using.
Yeah.
If we can save 1 or 2 lives by being a little bit more careful or by using hydroxychloroquine, I'm all for it.
Yeah, at this point, I don't know what the studies have been, but we always get people writing in like just make it available because that's what helps. But was there something particular that worked for you?
You mean like drug wise?
Yeah, or just anything. Like there's just so much myths out there about how you treat
You know,
this.
funny enough, I feel like vitamin D. Just getting out, and what I was doing to try to feel better was lay out in the sun in my backyard, and it really did help me feel better. Even if it was just psychological, for me it helped anyway. But I've heard other people say that vitamin D, and the best thing you can do to get that is be out in the sun. We got plenty of that here in Hawaii, and that's what I was doing.
That's true. That's good, and it's easy and it's free.
And get a great tan.
That you do. It looks like you did get a tan, but that was a while back.
It's my COVID tan. I also got a beard out of it,
Uh,
so
nice,
not all bad.
nice. Well, yeah, I think that's important to also highlight is because so many people might have it and feel like they don't need medicine, but if there are tips that you have for just kind of getting over it faster and helping, and
Yeah.
I don't
What I
know.
would say is the stuff that you do before you get COVID is probably going to be the stuff that's going to help you when you get it. I think the best thing you can do is keep yourself at a healthy weight, make sure that you have good cardiovascular health, eat well, protect your immune system. Anything that you do to protect your immune system is a good thing to do before you get the COVID, because it's that state of your body when that virus is attacking that's going to help you get through it safely.
Okay. Well, anything else
Then
you
again,
wanted to
I'm not
add?
a doctor.
Well, yeah, obviously from the perspective of someone who's lived through it. I don't know if there
Right.
was, it's always good to hear, you're the one who knows who had it, you had it. So if there was
Yeah.
something
Yeah.
that people could do to make them feel better, if they're not at the point where they're hospitalized, you know what I mean? So
Right.
anything else you want to
Right.
add? I mean, this was very good. I feel like I've learned a lot about it, a little bit more about the disease. So
I'm glad to hear it. I would just say take care of each other. And the best thing you can do is be overly cautious. And um, it's uncomfortable for everybody. And it's not the way any of us want to live. But if we can just be careful and take care of each other for these next few months or however long it takes, we're all going to come out and have a great big party at the end of it and celebrate being together and socially undistancing.
hopefully, hopefully.